Oh dear. Are you going to start whining, Archie? Can you hear him? No? Okay.
Okay, Marlena and Erin, I have 2:02, so are you all okay with beginning? I want to be conscious of everyone's time today.
Sure, we're happy to begin.
All right, great.
All right.
Good afternoon,
Hi.
everyone.
Go ahead.
Oh, I'm sorry, Erin.
No,
Good
go.
afternoon, everyone. My name is Leo Parker. I serve as the Director of Prevention Programs with NCSD. Today, we have the pleasure of having two great facilitators with us, Erin Sainato, our Senior Manager of Program Evaluation, and Marlene Kincaid, our Director of Training and Learning Center, who is going to present to us measuring training success. So I'll turn it over to Erin and Marlene.
Hi and welcome. My name is Erin Sainato. I'm the Senior Manager of Program Evaluation here at NCSD, and I am here with Marlene Kincaid. She is the Director of our Training and Learning Center, so we'd like to welcome you to Measuring Training Success. We're going to talk a little bit about training evaluation today and share some resources with you on evaluating your training. We've split the webinar into two sections. My section will cover evaluation overall, and Marlene will do a little bit of a deeper dive into different types of training evaluation. So for my first slide, I want to talk about why evaluate training. So why are we doing this in the first place? It's a lot of effort and a lot of work, and why do we do it? So the first reason that we do evaluation and training is to measure impact. So it's nice to have some anecdotal stories, or to say, I'm pretty sure that this is true, or I think I know that this is true. But by doing a formal evaluation, you can really have some data behind the beliefs that you have that can show you different parts of what's successful and what might not be as successful in your training. And that moves me on to informing. So when you evaluate your training, back one, please. Yeah, when you evaluate your training, you can use it as an information tool. So you'll hear me say a lot that evaluation is a learning tool. And I love this quote here from Michael Parkhurst that says, data that shows you are not meeting your targets is telling you something important. So just because you do an evaluation and you see that you're not meeting what you'd like to be meeting in your program or your training, doesn't mean that it's necessarily a bad thing. It means it's an area that needs attention. So it's an area that may need a little bit more tweaking or a little bit more resources, but the evaluation opens that up so that you can see what the issue is and where the issue is, and you can make changes and adjustments to your training program. Next slide, please. This is the evaluation cycle. It talks a little bit about, or it demonstrates how you do evaluation in real time with your project. So for step one, you want to plan. And as you're planning your training, you want to plan your evaluation too. So this helps you get targets so you can lay out your measurable outcomes and outputs, which we'll talk about in a couple of slides, but it helps you really solidify what you're going to be doing and what you're going to be evaluating, so you can do that hand in hand. What we want to do is build a culture of evaluation so that we aren't completing projects and doing an evaluation at the end as an afterthought. We really want evaluation to move along hand in hand with the project. So as you set your project plan, you set your evaluation plan. Step two is to implement your training. So in step two, you implement your training and you begin to collect the data that you're going to use to evaluate your training. In step three, you do the evaluation. So you do some analysis, you look at how many people passed your pre or post test, how many people took a satisfaction survey, what were your ratings on your satisfaction survey? And you can start to look at some of those percentages. And if you have baseline data, you can look at change over time, and you can work to improve your training. So that takes us right into step four, where you start to see very clearly areas that you're doing very well, and you'll see areas that maybe need a little bit more attention that you can give attention to. And then when you offer your next cycle of training, you can start back at step one with planning, looking at those outputs and outcomes. And you can do one of two things. You can tweak your evaluation if you feel like you missed something or there's a better way of doing it, or you can run the evaluation again to compare your first iteration with your second iteration to see if learning has changed between the two since you updated and changed your training based on the information that you received. Next slide, please. So before we dive deep into evaluation, I wanted to talk a little bit about terminology. Some of these terms are probably something you already know, but some of them might be a little bit new or a little bit more nuanced than you've seen in the past. So a goal is a broad statement of intended accomplishments. Methodology is how you're going to do it. So how are the data going to be collected? And this can be through methods such as surveys, focus groups, interviews. For training, you can do pre and post assessments and test scores. For input, input is what's going to go into your training evaluation or into your training itself or your program itself. So various resources available to you to support your training, such as staff, space, or equipment. And output is the direct result of the training. So for example, the number of people served or the number of resources created. And it is similar but different to an outcome, which is the intended accomplishments of the training. So do we want to see rates decrease? Do we want to see opinions improve? And we can look at that on the next slide to talk a little bit about what this difference is between outputs and outcomes. A baseline is really important. Unfortunately, it's not something that we always have handy and ready to go, but it's a really nice thing to have if you're able to do it. So it talks about the present or current state to which outputs and outcomes will be compared. So you can look at your current outputs and outcomes and see where they stand now. Are you at a 4 out of 5 on your training maybe? So then you run your evaluation with a tweaked training program and see if maybe your satisfaction goes up to a 4.5 out of 5. So your baseline is the 4, which is where you're at right now. And it's a nice comparison and change measurement tool. Next slide, please. So looking at outputs versus outcomes. Outputs are measure simple metrics like number of participants, hours, or things like that. So it really is the epitome of bean counting. It's just counting how many things happened. Whereas an outcome measures change and is more complex. I have an example down here at the bottom of the slide that talks about McDonald's sells 33 billion burgers per day. Five Guys sells 350 burgers per day. Can you tell just by sales who makes the better burger? And this really gets to the fact that your outputs need to support your outcomes. While burger sales and quality seem like they're very, very similar, we can't say that the better burger is the one that gets sold more in this case. That's a little presumptuous of us to assume. If you do a quality survey, if you do some interviews, you may find that people go to McDonald's because of convenience, but the burgers at Five Guys are really better. And you may see that people will overcome challenges such as Five Guys costs more. Five Guys doesn't have a drive-through, which is detrimental to me going anywhere. And they still will go to Five Guys because they prefer the quality. So the quality item is the outcome, but we can't measure that with the burgers. We have to measure that with something else, like an interview or a focus group or a survey. Next slide, please. So how does evaluation work and how do we go about this? And we've talked a little bit about this, but I want to dig into this. First, we make a plan. So we identify a problem and a solution. So we see a problem happening out in the real world, and we decide that training is the solution. So we plan our solution, but we also plan to document and collect data on what is happening. So we want to think about the levels of data we can collect. Maybe it's going to be training satisfaction, But maybe it's also going to be something that happens in the real world. Maybe it's going to be disease incidents. Maybe it's going to be congenital syphilis cases averted. Can training help with case closures? Can it help with something along that line where you can collect data about what's at the very end of the road that we're trying to measure as an outcome? Second, we're going to determine the method. So we're going to decide how to collect data to evaluate the training. And we have to remember that the outputs must support the outcomes. So you want to determine what data you'll be using to evaluate the training. Again, are you using pre and post test? Are you using surveys or focus groups or interviews? Generally, all training is evaluated through at least a satisfaction survey, but sometimes it's nice, especially for your more complex trainings or your trainings that are addressing really complex issues, to move down a little bit more into the outcome data to see if behaviors, attitudes are being changed. 3, if possible, you want to determine a baseline. So you want to see how your outputs and outcomes measure now. If you're able to run data, if you're able to count now, if you're able to dig through reviews or satisfaction surveys and see what is happening right now with your training, that is a very valuable tool to have. You'll then collect data in a lot of different ways that we've talked about, and you're going to want to collect that data and enter it somewhere. Probably a spreadsheet if you're doing it yourself, but maybe a database if you have more capacity for that. Tools like REDCap can be really beneficial for collecting and housing data if you need something a little more intense than just an Excel spreadsheet. And then finally, you'll create a report. So you'll analyze that data. You're going to compare what you have to a benchmark or to a baseline if you have a baseline, and create that report that shows we made progress here and we need to make progress in this area. So it'll show you different areas. Your report should demonstrate the different areas that where you're seeing a lot of success and where you're seeing room for growth. Next slide, please. And then this is just some sample analysis. So I came up with a hypothetical training that was offered in 2018. We've decided that we're going to retool this training and offer it again in 2019. So what we were able to do in this hypothetical training was pull the previous surveys that were taken from the training when we initially offered it in 2018. And then we run the training and we pull satisfaction surveys again in 2019. So same training, retooled. We want to compare the satisfaction, how they're doing on the post test, and if they will use that information. And we can see that in 2019, 66% of participants were satisfied with the training, and that moved up to 77% in 2019. So that's excellent news. We're really happy with that. However, when we look at who passed the post test, we see that it didn't change. So we had 72% in 2018 and 72% in 2019. This could be an area that we need to improve in. Maybe we made some good changes that help with that satisfaction, but the content still isn't getting through the way we hoped. So we want to make some changes to how we're delivering that content to increase the amount of students that pass the post test. And then when we look at if they'll use the information in the field in the future, in 2018, we had 55% who said this is great information that I will use. And after we retool the training, we moved that up to 68%. So this is just an example of how you can use this almost as an infographic within a report. Typically, some narrative would come with this, and some explanation and some breaking down of the data as I did orally. You could do that in your report and then pass this on to decision makers or grant makers, demonstrating the impact of your training. And when we do evaluation, we do want to tie this back to our impact, and moving away from anecdotal cases. Even though that information is important, it's just a lot better to use anecdotal data in conjunction with quantitative data that we have collected and analyzed in a standardized way to demonstrate value and to demonstrate impact. Next slide, please. That's everything for me on the basics of evaluation, and I will turn this over to Marlene, and she's going to talk to you about training evaluation tools.
Thank you, Erin. So now that we understand the purpose and the process of training evaluations, let's take a look at the evaluation tools that are available for training evaluation. Why is it important to implement training and evaluation? Because capacity building is a matter of training. Capacity building via training is the transfer of knowledge, skills, or attitudes, otherwise known as KSAs, as well as ideas and context through structured learning and follow-up activities that solve and develop competencies, enhance performance, solve problems, and fill identified performance gaps. When we look at the capacity via training, there are a lot of areas that need to be covered. Training, which is the giving of information and knowledge that is internalized and demonstrated through practice. Learning, the process of absorbing information in order to increase skills and abilities and make use of it under various contexts. Knowledge, the facts, the information, and the skills acquired through experience and education. Coaching, which is one-to-one support for the here and now rather than the distant past or the future. Skills, which encompasses the knowledge, competencies, and abilities to perform operational tasks. Development, which is the broadening and deepening of the knowledge in line with one's development goals. And finally, support, which is the ongoing feedback and resources to effectively do one's job. Training evaluation as a tool is a best practice. It is how we know how we are making a difference. It is a systematic process of collecting information to improve performance outcomes. It also aligns training with evidence-based decision-making. And lastly, it begins before the training program even starts, just as Erin mentioned earlier. Evaluations tools create a common language. It puts everybody on the same page as to what the learner needs to learn and the direction in which we need to go. It also enables us to steer the ship, so to speak, pointing us towards the direction in which we can make plans and we can target the outcomes we are looking for. It identifies obstacles as well that you may not know were there. Oftentimes we assume we know what the problem is and we undergo training to target that problem without evaluation or analysis. This ultimately leads to no change in behavior and the problem continues. And then it connects the initiative with the results. Without the measurement procedure in place, the organization is aimlessly traveling along the road with no purpose. So this connects the initiative with the results, what your outcomes are targeted to be. When we think of training evaluation, there are stages of training evaluation. There's the organizational analysis, which is often not done. However, this is a very beneficial stage. Organizational analysis is the alignment between the training goals and the organizational objectives. This is where you get buy-in. This involves identifying and removing or at least minimizing organizational obstacles that might make the training less effective. This is also where you identify the importance of training to the organization. The more important training is to leadership and the organization, the better the outcomes will be. A job task analysis is another form of an evaluation tool. This is a systematic breakdown of a job into its component parts. The goal of the job task analysis is to produce a list of tasks required to perform a particular job, and then for each task, it identifies the skills and competencies needed to perform the task. A needs assessment is the what the organization needs or has that precedes the gap analysis, which is the how to close the gap between where the organization currently is and where they want or need to be. The gap analysis is the method of assessing that performance of an organization to determine whether organizations required objectives are being met, and if not, what steps should be taken to meet them. Oftentimes, people just target the needs analysis and they forgo the gap analysis. In my experience, the gap analysis is a very valuable tool because it lets you know what should be there and what isn't. Then we have the Kirkpatrick-Phillips evaluation model. This is a globally recognized method of evaluating the results of training and learning programs. It assesses both formal and informal training methods. So as we look at the slide here, organizational analysis, job task analysis, needs analysis, and gap analysis will all take place before any training is conducted. The Kirkpatrick-Phillips evaluation model is the process that takes place once training is implemented. But it is also based off of the previous organizational analysis, job task analysis, needs analysis, and gap analysis. Do you need to do all of these and use all of these evaluation tools? No, you don't. And a lot of organizations target one specific tool, one or two specific tools that may help in the development of their training. What we have here is the Kirkpatrick-Phillips 5 levels of evaluation. You've probably heard of the Kirkpatrick 4 levels of evaluation that was developed in 1959 and has gone through several revisions since. It is, however, the gold standard in training evaluation. In the early 2000s, Jack Phillips came out with an addition to the 4 levels of evaluation, thus changing Kirkpatrick's 4 levels to Kirkpatrick-Phillips 5 levels of evaluation. The 5th level is return on investment. This level commonly is referred to as the 5th evaluation and compares the program's overall cost to its monetary benefits. We'll take a look at that more closely in the upcoming slides. But as you look at this particular slide, what you can see on the left-hand side is the alignment and forecasting. What it is you need to start with when you consider each of these levels. And then to the right-hand side is the end result, and that is the type of evaluation tool that takes place. So you have your initial analysis on the left-hand side and the corresponding measurement and evaluation on the right-hand side. We will take a look at each one of these levels individually in the upcoming slides. Whoops. Oh, okay, so that should read right there, level 1. Apologies, it's typo. So level 1 is reaction. Reaction is the satisfaction or otherwise known as the smile sheet. It's the sheet that's typically given out at the end of a training. And it measures the degree to which learners just simply react to the training. It is also the perception of training effectiveness that the learners may have. The examples of this type of level evaluation is surveys, focus groups, and interviews. Some of the guidelines for implementing this particular level is making sure that you assess the method of training, the content of training, the media in which the training was delivered, the trainer, the course materials, and the learning environment and or facilities. It's also important that at the level 1 reaction evaluation, that it's done immediately, if not at the end of the course, immediately within the next 24 hours. After 24 hours, a learner forgets. and they're not responding based on their reaction anymore. So this is why it's important to have level 1 evaluations conducted immediately after the training. Level 2 is the learning level of evaluation. It measures the extent to which learners change attitudes, increase knowledge, and or increase skill. It is the degree to which knowledge was acquired. Examples of level 2 evaluations are the pre-test and post-test. The pre-test is also very similar to what Erin mentioned as the benchmark or the baseline. Then there's also the rubric scoring method, assignments, discussions, and Q&A. For the level 2 learning, some guidelines are aligning the evaluation measures to the training objectives. Also asking more than one question. And if you are going to use a formal type of assessment or test, focus on multiple choice versus true and false. This adds more critical thinking for the learner. And also avoid negative questions. For example, what is not a motivational technique? This is considered a guideline because you don't want to know what the learner doesn't know. You really want to focus on what the learner does know. Level 3 is behavior. This measures the extent to which learners apply new knowledge and skills. It is the degree to which knowledge is demonstrated, and most importantly, it is the transfer of knowledge from classroom to real world. Some examples of behaviors, behavioral level 3 are on-the-job performance, performance reviews, shadowing and mentoring, performance benchmarks, and observation. Some guiding principles for level 3 behavior evaluation is the desire to change. So a learner can be presented with the knowledge, they can intake the knowledge, they may be successful on an actual post-test, but if they don't have the desire to change, they won't transfer that knowledge from the classroom to the real world. So it's important for us as an organization to create that environment in which change is encouraged. And we do this by rewarding the change that is desired, presenting a supportive environment in which learning is encouraged, reinforcing the behaviors that we want in our staff and our employees and our colleagues, and making sure that behavioral change is required. A lot of times, if you just say, hey, it's good for you to know, a person will choose whether or not they want to implement that behavioral change. So it's important to actually say the impact of that change and why it's important that an individual learner applies and transfers that learning. Also, it's important to allow time for adaptation and behavioral change to take place. Behavioral change does not happen overnight. It can take up to 60 to 90 days to have that behavioral change take place and be a sustainable transfer of knowledge. Level 4 is results. How do we measure results? Results is measured through impact of training on an organization and or a community. Some examples of what a level 4 results evaluation look for is evidence. So you want to see the evidence that the transfer of knowledge has taken place. You would like to look at some data metrics comparisons. So if you have that baseline, then you want to use that data to see an increase or decrease in the data in whatever way you want to see it. You may want to decrease safety incidences, or you may want to increase the amount of testing that takes place. You will also look at the data metric comparison from pre and post test back in level 2. take another look at surveys, interviews, and also take a look at key performance indicators that have been set by the organization for behavioral change. Some guidelines for level 4 is to target the outcomes. It's important to know where you want the learner to go in the training, and that's how you measure the results. If you target what behaviors and outcomes you want, then that is what you are going to measure on at the end of the training. Once again, allow time for change to take place and identify the impacting factors that are outside the evaluation control. For example, if you did a training and started a training during COVID, and then COVID hit, the environmental factors changed drastically. So as a result, you either have to change your evaluation tool and or your evaluation method, or you need to factor in those outside factors that impacted the training and the ending result. And most importantly, you need to follow through and repeat. Level 4 is often not obtained in the training real world scenarios. Most times agencies and organizations are moving too quickly to evaluate the training. And that unfortunately is an excuse that really hinders progress moving forward for our learners as well as for our organization. So it's important to really take the time, regardless of how fast the organization is moving, in order to really measure those results and those outcomes to ensure that training is aligned. So you want to follow through on that, and then you want to repeat it down the road. You will continually want to measure training to make sure it sticks. Lastly, the level 5 that was added in the early 2000s is called return on investment. Return on investment compares the monetary value of an organizational outcome with the cost of the training program. With ROI, we focus on the net benefit of the training to the organization. For example, let's say you want to reduce training, you want to reduce the safety accidents that are occurring in the field. So you train 50 people to do on a safety program. This results in a decrease of 20 accidents over the course of a year. This had a monetary value to the organization of $100,000 per year with reduced worker compensation and sick leave. The total cost of the program was $50,000. So what we do is we take the return and the benefit and we divide it by the investment or cost of the training. So in this case, we take $100,000, divide it by $50,000, and we end up with 2. In other words, for every $1 that we spent on the training program to develop it, we had a $2 return on investment. This means, again, that we have value in the training program. And this type of evaluation is a great way to prove training is successful to an organization, especially an organization that is struggling to fund training. Oftentimes, training funds are pushed to the side as it's a lack of a necessity, when in reality, it can save money and it can produce money. So if training is done correctly, then it can be highly successful and it can be a very high value to an organization. And so return on investment has been very successful in proving a lot of programs out there and getting continued funding for training initiatives. There's also been a lot of white papers written, especially in the public health arena, about the return on investment when it comes to training. So if you can do a return on investment evaluation, I strongly recommend it. when we talk about training evaluations, we should target the levels that we want. Again, it's understood that, you know, we may not be able to implement all evaluation tools. We have to be selective. And it's also understood that the changing environment and some outside factors may limit the level of trainings that you can implement. But overall, we should have a target number of training evaluations that we want to be able to facilitate and execute. We should be able to execute 100% of any level 1 evaluations. They're the simple ones. They're the smile sheets. We should be able to implement them both asynchronously and synchronously. So they should be always there to do. We should target 90% of a level 2 evaluation. And then we should target 30% of a level 3 evaluation. We should try to target accomplishing a 10 to 20% of a level 4 evaluation. And then hopefully, if you can just target a couple programs a year, for a 5 to 10% level of 5 evaluation. Again, the level 5 evaluation is an incredible tool to gain funding for training initiatives. That brings us to the conclusion of our training. I'd like to open it now to questions that we may have out there.
Marlena, I see a question in the chat about your percentages. It says, I don't understand what this means, the training evaluation target percentages.
Yeah. I can go back there. So what that means is that a lot of times, especially when I'm brought into a situation and people want me to do a training or to improve a training, I'm looking for these evaluations. I'm looking to see what the outcomes of the current training is. Unfortunately, as much as we want to say that we do evaluations for every single training that we initiate, there's a lot of organizations and agencies and locations that are not able to do that, or worse yet, they do the evaluations, but they don't report out on them or summarize the results. So these percentages means this is what you absolutely should target doing as a benchmark. So for every training that you do, we should absolutely 100% have a level 1 evaluation at the end of the training. No excuses. Level 2, we should focus to get 90% of that done. So, you know, if we look back on level 2, we're looking back at the learning aspect of it. So we're looking back at doing a pre or a post test. And a lot of times we may start the pre-test, but things get in the way and we don't complete the post-test. So that's the reason we try to say, target getting this done, target reaching for level 2. And then same thing for level 3, target completing at least 30% of the time getting to level 3. You know, if we're honest with ourselves, a lot of the organizations, locations, and agencies simply stop at level 1. But there needs to be a recognizing that level 2, level 3, level 4, and level 5 also add value to the total package of the training. So that's why we say target this, try to set yourself a goal and make sure that you're accomplishing in this at least 5% of the time, at least 20% of the time, at least 30% of the time, and so on. Did that help? I'm gonna hope so.
It helped somewhat.
I guess the question back is, you know, how often are you doing them? When you think about these targets, how often are you doing a level 1? How often are you doing a level 2? So that can help you set that target. If you recognize that, oh, I'm not doing level 2, I'm not doing level 3, I'm not doing level 4, I'm not doing level 5, then set yourself a goal to achieve that. Okay, so the next question is, are there any formulas that can be used to estimate the amount of hours needed to complete varying levels of evaluation? So there are definitely tools and formulas for that, just as there are formulas for developing training. When we do a training needs assessment, you want to spend a lot of time making sure you're asking the right questions. So that may take 30 to 45 days. Just, identifying the areas you want to target for a question and then formulating the question to make sure you're getting the outcomes that you want. And then you want to implement the training. You don't want to keep you want to implement the evaluation. You don't want to keep it out there forever when it comes to a survey or training needs analysis. So you'll set a time for like 2 week turnaround in which you distribute it, collect the data, and then another 30, possibly 45 days, depending upon the amount of survey respondents you have, to just calculate and read the results and form a summary. So that's for training needs analysis. For a level 1 smiley sheet, there should be standard questions that you have. So that is relatively quick. When you look at level 2, that might involve a supervisor on the job. So that might take a little bit longer, and you're not doing that right away. You're doing it 30 to 90 days out. So there are definitely criterias and formulas for each one of these evaluation types. Would you mind? Is that the last question? Yeah, the definitions. I can go back here. Why don't I go back to this? So here's your 5 levels of evaluation. Is this what you're referring to? Thumbs up. Hopefully. Oh, yes. Great. Thank you, Mary. So level 1 is reaction. Level 2 is learning. Level 3 is application. Level 4 is impact, and level 5 is return on investment. Yeah. Always remember level 1 is your smile sheet. That's what it's called, because again, you're not really measuring the comprehension of learning. You're measuring the perception and the feeling of learning. Any additional questions that we may answer for you today?
I wanted to put a plug in for a couple of books that I have used. I'm going to undo my background so you can see them when I hold them up. Just 1 second. Oh, it's going to blur. Hold on. Okay. One is Nonprofit Program Evaluation Made Simple by Chari Smith. And we'll send these book titles out when we send all the materials out, but this has been a great book. It's the basics of program evaluation, and it's also very useful for training evaluation. And then I also have Kirkpatrick's 4 levels of training evaluation. There's the 5th level as well. You can find information of that online, but this has been really useful as well in learning about training evaluation. And that's by Kirkpatrick. So we'll share these out with you as well.
Well, if you have additional questions, I don't know if you're like me, I go to bed at night and I'm like, I should have asked that question. I should have said that. If you're like me and you do that, please don't hesitate to reach out to Erin or myself or even Leo with any questions that we can help and follow up with. We're happy to help you with your evaluation needs. So ask us anything at any time.
Thank you, Marlene and Erin. And to the participants, just as a reminder, we will be sharing these materials with you all after today's webinar. We will send out the recording along with a copy of the slides, along with the materials that Erin shared, as well as a brief survey so that we will know, get your thoughts on today's webinar. Marlena, Erin, do you have any last comments, or are there any additional questions that we may have from any participants? If you have any, please feel free to put them in the Q&A.
I would just encourage you to contact us with any questions. What do we have a main mailbox that they could use for that, Marlena? Could they use the learning mailbox for that?
Yes, they can.
And do you remember the address for that by any chance?
Actually, I have to look it up.
Just
But
one
I can
second,
also
please.
provide that to Leo to send out as well.
Okay, yeah, we'll send you our emails when Leo sends out information. And yeah, I do evaluation all the time, and I really love evaluation. It's right in my heart. So if you have questions, please feel free to reach out to me. It's been great having you all on to share with you. Evaluation is a passion of mine, so I'm just so happy to see everybody here.
Yeah, and I also second Erin's comments. It's great to have you here to learn about evaluation. And I encourage you to go back and take a look at your evaluation protocols and the different types of tools that you currently use, or types of tools that you may want to use. And again, to reach out to us, because we are here to support you.
And I see we have one additional question just jumped into the
Okay.
Q&A. Oh, great presentation from Mary Prim.
Oh, thank you, Mary.
Yes, thank you, Mary.
And if we have no additional questions, we thank you all for participating in today's webinar on measuring training success. And we hope that you have a good rest of the afternoon.
Thank you.